All right, so let's look at strategic thinking or strategic planning in public health management. And in this session, we'll basically look at what strategic thinking is, why is it important, what are the steps that we need to undertake in doing strategic planning, and in what frameworks can we use in strategic planning, and or perhaps what frameworks can we use in situational analysis as one of the steps of strategic planning. Okay, so how can we conduct strategic planning, and what approaches, what models can we really use in identifying strategic problems and interventions? So what frameworks can allow us to arrive at uh, the strategic decisions, or what frameworks can we use in arriving at the strategic options that we have in pushing the organization forward. And then you also look at, in our presentation, you also see what a strategic plan is and how it looks like. What's the format, okay, the format of the strategic plan for any organization or for any public health program. So that is our area of focus this evening. So strategic planning is very important in public health because it allows us to make decisions and take actions that would basically guide what the public health organization will be engaged in. Okay, public health organizations are involved in activities that promote health, prevent disease, and also prolong life. Okay, and improving the overall population health outcomes. Basically, that's the role of public health organizations. And therefore, when we are planning for what the organization will do in the next 2 to 5 years, we are basically involved in what we call strategic planning. So strategic planning involves you assessing the environment to create a vision for the future. Okay, so you see where you are, and then you paint a picture of where you want to be in future. So that means that you first need to understand the environment in which you operate in. Okay, understand the dynamics of that environment, both internal and external, and then set a plan of action that can position the organization in such a way that it can achieve its mission. Okay, so strategic planning is that process of producing fundamental decisions and action on what will shape and guide what a public health organization will do, and why it does what it does. That is very, very vital. Okay. So for you to be a person who is very good at strategic planning, you need to be very good at strategic thinking. So strategic thinkers are those individuals who understand that the environment is not always static and change is always going to happen. So if change is to happen, it needs to find when the organization is well placed to maneuver in the new environment. So as a strategic thinker or as a strategic planner, you need to acknowledge that change is always going to happen and it is necessary. Okay, and that's one. Two is that you should be a person who questions assumptions and realities. This is to say that you should be a highly a person who is inquisitive, who questions the things, um, who thinks beyond what the ordinary person could do, really think. Okay, you should be able to see beyond the horizon. Okay, so you should really question the way things are being done, such that you can think about ways in which things should be done. Okay, if you're comfortable with what is currently being done, then um, you cannot think beyond what you see. But if you start to think beyond what you see, then this creates room for uh, innovation, entrepreneurship, and also questioning some of the realities that we actually experience in our daily lives. Okay? And then three is that build an understanding of systems. Okay? I've often explained the concept of systems thinking in public health. Who can help us explain that concept? What is systems thinking in public health? I'm waiting. Yes, Rose. Mm-hmm. Anyone
I don't
tell us what
have an
systems?
idea.
Hey, Rose. Another person, Daniel?
Yes, let me try, sir.
Yes, go ahead.
System thinking in public health it is like exploring and developing effective actions.
Raise your voice a little bit. We'll speak closer to your mic.
Yeah, I say system thinking in public health it is like exploring and developing new effective actions.
Mm.
That's the idea I have. Thank you.
Yes, thank you very much. When we think about systems, we are basically thinking about the actors, the institutions, the organizations that play an important role in public health. So if you have a problem that you want to address, you need to look at how the different organizations, actors, institutions, or entities, how they will respond towards that problem, or what are they already doing towards that problem. So that kind of thinking is very, 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 very vital in the public health. And that is basically what we call systems thinking. Okay, we have um, what you call public health system. Okay, public health system. When we talk about public health systems, we are talking about the institutions or the actors or the individuals or the organizations or the institutes, entities, research, whatever it is, think tanks, every entity that is involved in public health. That's what we call public health systems. Now, when we talk about systems thinking in public health, it means that we are using the lenses of recognizing that public health, um, the public health activities in a given locality are performed by different actors. So we need to know how these actors operate. So we look at the networks, we look at the interventions that they do, the influence that they have, everything. Okay, that is what we call systems thinking. So as a strategic um, thinker, you should be able to see things in terms of systems. which is very important, because thinking in terms of systems allows you not to do things in what we call silos. Another term here is silos, which is also very common in our public health interventions. When we talk about silos, what do we mean? Mm-hmm. Hey, people have not been used to these words, eh? So silos is when we do things not in a very coordinated way. Okay, not in a very coordinated way. You find that organization A is doing almost the same thing that organization B is doing, but they are not working together. Okay, there is no way they are actually meeting. Everyone is doing their own things. That's what we call working in silos. So we don't want to do our public health work in terms of silos, because it creates duplication, wastage of resources, partnerships and collaborations, and what we call information sharing. These are very important. If you're doing interventions in disseminating sexual and reproductive health information, and then you should be able to share with another entity which could be doing activities to do with family planning provision. Okay, such that what you do is basically coordinate, and that there is even a forum where you meet and interact, such that your activities uh, um, are not spread out and everyone is doing what they want or what they think is right. Okay, so the other point is envision possible futures. Okay, like see where you want to be. Seeing where you want to be is very important, especially for leaders, because leaders actually the leaders sell vision. Okay, um, a good leader should be able to sell vision. Okay, and that vision is what you can call the promised land, where we want to be in terms of public health. We want to be in a country where everyone has access to healthcare services, quality healthcare services, or where every homestead should be within 3 kilometers from the health facility. That's a vision. Okay, that's what you have in mind, and then you have this plan of achieving that vision, that strategic plan. Generate new ideas. Okay, there is a video which is trending currently, and that video is about a politician who is a little bit young. About he should be in his 40s, and in terms of hierarchy, is about number, because they say the Speaker of Parliament is number 3 in Uganda in terms of hierarchy. So the video which is trending is for the Deputy Speaker of Parliament, and in that video, he's saying, he was talking to the people who liberated Uganda, and he was saying that the problems that we had, or the questions that you had when you are liberating the country, are the same questions that we have now, but the answers are different. Okay, the answers are different, and that video is making rounds. Of course, it is a video that was made long time ago, but it is just surfacing now. That is what is happening with the online environment. Something which is very old, if someone has seen it today, they think it is very new, yet it is actually an old thing. So that video is an old one. So he was saying that the problems that Uganda had in the 1980s are actually almost the same problems that we are having now. But the way of addressing those problems is actually different. Okay? It's the same way of saying that you cannot address a current problem with the solutions of yesterday or of the yesteryears. No. So we have new, we can say that we have new ideas to the problems that have always been existing with us. So that is point, the second last point, that we should be able to generate new ideas. Okay, we can have all these problems of lack of access to healthcare services, people are not accessing drugs, but access to drugs has always been a problem in the health system, especially in developing countries. And previously, solutions could be build more hospitals, make sure that those hospitals are equipped and things like that. But a new solution could be that, okay, let us have mobile pharmacies. Let us digitalize our pharmaceutical systems. Okay, you see that the solutions are different from what another person who lived in the yesteryears could suggest. Okay, and then the other issue is that the strategic thinker should be able to analyze the external environment and then be able to determine what is fit for that environment. That is also a very, very important point there. Okay, so we move to the next slide. So strategic planning, basically, we just need to note that it gives us the roadmap. It is a plan that contains objectives, the goals, the actions that we will undertake, and how we basically evaluate these actions for in the organization in terms of where we want the organization to be. Okay, so it helps us. The moment we have a plan, it helps us in making decisions, allocating resources, and we can also foresee problems or challenges and then be able to put mitigation measures. Okay, so I will still repeat that strategic planning gives us a roadmap that we can follow in order to reach where we want to reach. So if you're going to use the real words in terms of organizational management, is that for the organization to be operating on a day-to-day basis, the day-to-day operations of that organization are coming from what the organization decided to do for the next 5 or even 7 or even 10 years. Okay, so for you, when you report to go and work, let us say in a vaccination campaign for COVID or for any other illness, it was actually put in the plan for the organization that we shall be providing these services, and these are the indicators that we shall have. Okay, so it means that as for you, you wake up and go and do this, which I can call operational activities, the groundwork. That groundwork was laid by people who did the strategic planning, and usually strategic planning is done by the top management. But of course, currently, we promote what we call participatory planning. Okay, even the nurse in the ward can contribute to formulating the strategic plan. Okay, you want to really see that the strategic plan has input even from the lower levels of management. Okay, so it gives us a direction of where we want to go, and in doing so, we anticipate resources that we shall use, whether they are financial, whether they are human resource, whether they are capital resources. So it gives us an impression of what resources we will need to use. And then that means that decision-making process at the operational level becomes very difficult, because already the plan is actually very easy, is very clear. So everyone can now focus. If you see, one of the things in strategic planning is that the plan needs to be communicated to the members of the organization. Okay, such that everyone now knows that yes, our target in the next 5 years is to immunize 2,000 children aged below the age of 5. Okay, so it also establishes that focus and that commitment from the staff. Okay, so when you do proper strategic planning, you really you produce this well-documented plan that communicates the intent. It communicates the intent or the objectives of the organization, where the resources are going to come from, how you're going to measure performance. Okay, because you have a section for monitoring and evaluation. So the benefits of strategic planning are quite many. Okay, even if I may ask, as you as a person, you have a strategic plan, a personal strategic plan in the next 5 years. Where do you want to see yourself? Or things happen by accident. Okay, if things happen by accident, then you shouldn't be surprised if you are nowhere in your journey. Okay, if you don't know where you're heading, you will head nowhere. It's basically, if you have no destination, then you're not going to head anywhere. That's the main point. It's the same thing with the organization. If the organization does not have a direction, then you're not going to head anywhere. So we move to how we can conduct strategic planning. The first thing is the situation analysis. Okay, this is basically a simple illustration of how strategic planning is done. Okay, but it does not necessarily mean that the phases are actually very static. Okay, so for example, in the slide we are saying you need to conduct situation analysis. You need to understand where you are. Okay, so in terms of public health, if you are going to plan for the organization, you need to first assess where you are. That is, with the data that you have, what are the health needs of the population? What have you managed to achieve? If it is in terms of vaccinations, how many vaccinations have you carried out? How many children remain unvaccinated? How many people are breastfeeding? How many people are, what illnesses are prevailing? How many health facilities do we have? How many health workers do we have? What resources do we have? How much money do we have? All the things. So you answer those questions. What is the current state internally and then externally? This is very important. You first need to know where you are before you know where you want to go. Okay. Now, in the other figure that you see on your screen, we have basically 4 steps of strategic planning. You prepare for planning, okay? Conduct the strategic planning, implement, and then monitor and evaluation. So that, you see, that is quite different from what I've just illustrated in the first step. Okay, that's why I said it is not very, very static. When you're doing it practically, the steps can really be different. But of course, if you're going to do strategic planning, usually if it is in a practical sense, some organization decide to allocate money for strategic planning. Okay, they say this money is going to facilitate the sessions for strategic planning. So usually you will see the organization moving to a very conducive place, okay, where they can really have these sessions of planning. So they can go for 5 days or 1 week to make sure that they really look at such that the output is basically a strategic plan. Okay, so if that is going to be the situation, it means that you really need to get everyone informed, people get ready, you secure the funds, you gather all the relevant information, you prepare, you make presentations will happen, consensus building issues. You may even have groups, say this group is for M&E, this group is for the implementation plan. So you see, you have a lot of activities in actual sense in preparing for strategic planning. You also, like I said, you have committees, you have leaders, you give them responsibilities. Say, you're responsible, this you're responsible, and things like that. And then now, when you go for that retreat, it means that you have put you have the resources and the materials and everything is in order. So now the sessions start. Okay, when the sessions start, you ask yourself questions and then you give answers. Okay, so you start to ask who you are as an organization. Okay, this is usually an important question for the staff. You have staff who join an organization and they don't know what the organization is, what the mission is, what the vision is. And even when I ask now for the organization that you work for, can you really state the vision and the mission of that organization? And what are their values? Okay, so very few of you really tell me that. So you first ask yourselves those questions. So you can have a presentation on this, or it can be a brainstorming session, and then you cover these questions. Well, where are we? Okay, when you look around, where are you in terms of as an organization? Are you the most prominent? Are you the ones delivering the most reproductive health commodities? Okay, what are you? Okay, so you can conduct a SWOT analysis under that to get that. Where do you need to go? That means the goals. Who do you need to work with? That is strategic partners, strategic priorities, the objectives. How are you going to get there? And when are you going to get there? So that means you also look at the time frame issues there. Then you move to the implementation. Okay, this is where you have the implementation plan, or you can even term it the operational plan. Okay, so from the strategic plan, you can have a number of other plans. You can have the monitoring and evaluation plan. You can have the implementation plan, or you can call it the operational plan. Okay, so still the financial plan can come in. Okay, you can have a bit of that also. And then human resource. So definitely after you have decided what you're going to do, then you look at the resources that you want to use. So all these, whether it is human resource, whether it is financial, can lie under the implementation plan. Okay, so you will see that the strategic plan document has everything that you really need to know about what the organization is doing. Okay, so assuming you are basically starting the organization. Okay, you're starting the organization, and that organization is called, let us say, Yei Health Initiative. Okay, so you're starting it from scratch. That means that you want to determine um, how this organization needs to look like given the prevailing situation. So, for example, you have done the situation analysis. You now know where we are. Now you have created an organization. So with that organization, it needs to come, you need to have the mission and vision for it. Okay? So how do you draft the vision and mission for this organization that you're starting to deal with the particular problem that you have identified? So for a vision, is that statement that outlines the ideal future state of public health for the community where you want to work in. What do you want to see? Okay. You want to see a community where people have access.
Hello. Yeah, I can't hear anything. I don't know whether it is poor connectivity from my side or. Yeah, your body moves, but we are not hearing your voice at all.
My mic, the power went off, but I believe you should be able to hear me now, right? Are we on the same page?
Yeah, yeah.
All right. Okay. My mic went off and then they had issues, but let's just continue. Okay, so the last step of strategic planning is creating what we call the monitoring, the implementation plan, and then the monitoring and evaluation plan. We have just combined them into two, but basically you need to know how the activities be rolling out. So that is the implementation plan, and then you need to see how you'll be able to evaluate your interventions. Okay, so earlier on, we talked about situation analysis, where we basically looked at the fact that you really need to assess your environment, where you're operating from. Next moment. All right, so you need to do an assessment of the environment, of what we are calling environmental examination here. Okay, so with the environmental examination, you're basically looking at two things: the internal and the external environment. When you do this analysis, it allows you to really get to understand the community needs and challenges, and also your own organizational issues that you need to really address. So it is very, very vital to do that. Okay, so the objective is that you get data, what is affecting the organization of the internal factors, and then you also look at the external factors and how they can impact the organization, and then it gives you signals on the potential challenges that can emerge. Then you can be able to predict what can happen and how you can actually solve these problems. Okay, so when you conduct this external environment analysis, it gives you a very good indication of where you are and what you basically need to do. And it's also very important to engage with the other stakeholders in your external environment analysis. Okay, these stakeholders come from either educational institutions, government, public health agencies. They can come from religious institutions, think tanks, religious research institutions, things like that. Even the communities. So for you to do an external environmental analysis, you can follow the following. One is environmental scanning. Okay, you look at data from different sources and then look at how they can affect the organization. So look at the technological factors, political factors, economic, social, and regulatory factors that can affect. So you need to categorize those factors through those different categories, and then monitor trends. If it is about, let us say, the problem that you want to really look at is the teenage pregnancy. That teenage pregnancy is the problem. Then you need to see what the trends are. Okay, is the problem increasing? What are people saying about the problem? Okay, so you need to track the issues, know what is happening around the issue that you are focused on. And then we move to step 3 of external environmental analysis, which is forecasting of future issues. Okay, having known the trends, you can be able to tell what the future looks like. So that's also another aspect that you can do. And then issue assessment. Okay, issue assessment, with it you evaluate the effect of expected changes on the organization. Okay, and this means that you really need to make an appropriate judgment, because often in these situations you don't have complete data, the problem that you want to address. So there is a lot of uncertainty, unclear data, also conflicting data. Internal environmental analysis and value creation is also very, very important. So you assess yourself as an organization in terms of the strengths and weaknesses that you have. So you look at the resources, the personnel, the expertise and things like that. You do an assessment of an internal assessment of the organization and see where you stand. What value are you in position to provide to the community? So if it's service delivery, is it support services that you're providing? Why are you actually existing? What value are you creating? That's an important question that needs to be addressed. So for the internal environmental analysis, you can use the SWOT analysis as the framework for assessing internal issues. Okay, we say that the SWOT analysis has the external and the internal part. The internal part are the strengths and weaknesses of the organization, and then the opportunities and threats are usually external factors. So you can use the SWOT analysis to really see where you are as an organization. Okay, and then evaluate your own relevance in the community where you serve. Okay, what value are you creating? Is what you're doing something very unique, or everyone is actually doing the same thing? Okay, or what you're doing is quite unique, but other people can easily copy it. That is imitability. People can easily imitate what you're doing or replicate what you're doing. Okay, so you need to ask yourself those questions. And then the last question is the issue of sustainability. Okay, as you also need to ask yourself. And then in other situations, you also still can be overtaken by the private sector. Okay, you can be a public health organization that is providing services that are also provided by a private sector organization. The difference, and I want you to notice this, is that you can have a public health organization that is running like a private sector organization. What does this mean? Is that you have a public health organization that is doing business. Basically, this business can be production of goods and services, but these are paid for in a commercial sense. But you can have public health organizations like the NGOs, where no one actually pays for the services or goods if they make, but they rely on donors, okay, to survive, make sure that they provide the services that they are providing. So, as if you are in the NGO one, and you're providing public health services, you can also reflect on the competition that you can face with from the private sector in certain situations. And then the last step of internal environmental analysis is focusing on the strength that you have against competitors. Of course, you will have weaknesses, but it's also very vital that you look at who you are and what strength you have over your competitors. That is a very important stage to take. Okay. Earlier on, we stated that when you're starting an organization, make sure that you have the mission and the vision well stated, the values, and we explain that. Okay. But if it is an organization which has been in existence, and in your process of making what we are calling the strategic plan, you need to make sure that the strategic plan is well aligned with the mission, vision, and the values of the organization. Okay, don't deviate. Do other things. Often, the chances of deviation happen if, for example, there is another donor who is telling you to do something different which does not align with your vision and mission. Okay. And also, you need to realize that donors will give you money based on your mission and vision. Okay. So it's very important that everything that you do in terms of strategic planning aligns well with the mission, vision, the values of the organization. Okay, I think we have looked at that. We will not go into details of that again. Values, we looked at that. Okay. So again, to stress the point here, just move here. Strategic planning, the ABCs of strategic planning. Where we are and where we want to be. What are the things that we need to do to be where we want to be? That is basically what we call strategic planning. That is the A, B, and C of strategic planning. So with the A is where we are. So you look at what you have. Okay? What you have and the environment around it. And then the C is where we want to be. So here, you of course you have the objectives, the mission, the vision. Okay? The structure of the organization, how you want the organization to look like, what activities you want it will provide, and things like that. Now, for you to get to where you want, you need to now implement the strategy. So that means that the strategy, you need to have it complete. So this strategy will have issues to do with the organizational design. How will the organization look like? What resources do you need? The technology, the communication, the human resource, the engineering aspect, the resource allocation of budgets, the hiring, all of things. The things are the ones which will take you where you want to be. Okay? So that is a simple way of understanding what strategic planning is. Okay, I think we can end here for now, unless you have any questions.